Welcome to Social Security Disability Help. Today I'm going to talk to you a little bit about filing for Social Security Disability with multiple sclerosis. If you go to our website, socialsecurity-disability.org, go to our Disabling Conditions page. You can scroll down and find information on multiple sclerosis there at the bottom of the page. And clicking through will take you to some information about filing for disability. Multiple sclerosis, often known simply as MS, is a disease that occurs when the fatty myelin sheaths surrounding the axons in the brain and spinal cord are damaged by attacks from the body's own immune system. Put simply, MS causes the immune system to destroy the coatings of nerve channels, shorting out nerve signals and limiting the capacity of the spinal cord and the brain to correspond with each other. Diagnosing multiple sclerosis can be difficult. Often, symptoms like dizziness, fatigue, tremor, chronic pain, or cognitive problems can be evaluated by a neurologist to determine if they are indicative of multiple sclerosis, but in many cases, proving a definitive link can be difficult. A precise diagnosis can be based on your medical records and neurological tests, and various specialized procedures including magnetic resonance imaging, lumbar or spinal taps punctures, evoked potentials, and blood analysis can help to accurately detect multiple sclerosis. Diagnosing this disease early is extremely important, since the progression of symptoms can be slowed significantly by treatment. When applying for Social Security disability benefits on the basis of MS, it is necessary to demonstrate that the state-run Disability Determination Services, or DDS, that a claimant's capacity to perform gainful work activity has been severely limited by the condition. Even if a claimant can provide strong medical evidence of disability based on MS, it is important to provide detailed information about the symptoms of the condition, particularly the limitations imposed on the day-to-day functioning of the patient. Corroborating a neurologist's diagnosis of multiple sclerosis with a long-term record of symptoms and impairments provided by a primary care physician, for example, will greatly strengthen a case for disability benefits. Medical factors listed in the Social Security Administration's Impairment Criteria Handbook, or Blue Book, that are used by the Disability Determination Services to decide whether to award Social Security disability benefits to individuals with MS include 1. Visual impairment, 2. Mental impairment involving behavioral and psychological abnormalities manifested by the presence of certain mental disorders, 3. Persistent motor function disorganization in the form of paralysis or paresis, ataxia, tremor, and sensory disturbances that may occur in different combinations, and 4. Significant motor function fatigue with considerable muscle weakness, particularly when performing repetitive activities. Obtaining disability benefits on the basis of multiple sclerosis can be difficult, particularly for younger claimants. If you currently suffer from this disease and believe that you have a strong case for Social Security Disability Insurance, or SSDI, or Supplemental Security Income, SSI, it is important that you fully understand the application and appeals processes before you send in your initial application. In most cases, working closely with medical professionals, along with a qualified Social Security attorney or disability advocate, can greatly increase the efficiency with which a claimant's rightful benefits are obtained. Thanks for visiting Social Security Disability Help. If you believe that you have a case or someone you know has a good case for Social Security disability benefits, if you scroll up to the top of the page, you have the ability to fill out a free evaluation for a consultation by a qualified attorney or advocate. Thanks for visiting, and check back often for updates on this and other disabling conditions.